moving from primarily learning about medicine to starting to practice it. And you didn't get here alone. I am delighted to see so many family and friends and supporters here in the audience. Their encouragement, patience, and belief in you helped you make it here today. Let's take a moment and give them a giant round of applause. Woo! The white coat that you will receive today carries deep meaning. It symbolizes scientific knowledge and trust. It also represents responsibility. As you enter clinics, people will look to you for answers and reassurance, seeing in your coat both dedication and commitment. It connects you to generations of Spartan veterinarians and veterinary nurses. When you receive your coat, check the left pocket. In there, you'll find a note written from one of those MSU graduates who've graduated sometime over the last 6 decades. They've offered you a personal message of encouragement and a bit of wisdom to carry forward with you. It should be a reminder that you are joining a community deeply committed to mentoring, supporting, and caring for its newest members. So carry their experience and their encouragement with you. And remember that someday you'll have the opportunity to pay it forward to the next generation. For our DVM and vet nursing students, this coat also represents partnership. Veterinary medicine is a team sport. In fact, MSU is one of only 4 veterinary schools in the country that has the DVM and vet nursing students training side by side, learning with and from one another. And that matters, because the strength of our profession lies in collaboration, in understanding and respecting one another's expertise and working together as a unified team to provide exceptional care. As a land-grant institution, Michigan State University was founded on the principle of service, bringing knowledge to communities and improving lives. That mission is reflected in the very model of team-based education and care. Whether you practice in a rural community someday, an urban hospital, on a commercial farm, or in a research laboratory, you're part of something bigger. The work that you're preparing to do matters, not just for individual patients, but for society. Today, as I look at all of you, I'm so proud of your hard work, proud of your growth, proud of the professionals that you're becoming. So at some point in the next couple of weeks, before you hit the officially hit the clinic floors, I want you to do something. I want you to put your white coat on in a moment by yourself and look in the mirror and imagine the patients that you will care for, the families that you will guide, the communities that you will serve. Then take a deep breath, exhale, and smile. You are ready. Wear your coat with integrity, with compassion, and wear it with pride. Congratulations on this transition into clinical training. I'm so proud of each of you. On that note, I am so delighted to introduce you to 2 of our student speakers today. Please welcome Elizabeth Durkach, our veterinary nursing student representative, followed by Megan White, president of the DVM class of 2027. Elizabeth?
Thank you, Dean Dodd. That was lovely. Good afternoon, everyone, faculty, family, friends, and my fellow classmates. It is an honor to stand here today as we celebrate this incredible milestone in our journey. The moment we don the white coat and step closer to the profession we have dreamed about for so long. The white coat is not just a uniform. It is a symbol of responsibility, compassion, science, and trust. When we put it on, we join generations of veterinary professionals who have devoted their lives to healing, protecting, and understanding the animals who share our world. It reminds us that every patient we treat, every client we comfort, and every case we help solve carries both scientific and ethical duty. Getting to this point was not easy. We memorized anatomy down to the smallest muscle, learned to read the silent language of pain in animals who cannot speak, and pushed through long nights fueled by caffeine, friendship, and determination. Through every challenge, whether placing our first IV catheter, anesthetizing a patient, wrestling sheep, or facing ethical decisions, we have grown stronger, wiser, and more compassionate. As we step into clinics wearing these coats, we carry the weight of trust from animals who rely on us, clients who believe in us, and colleagues who will guide us. Our work demands knowledge and precision, but also empathy, patience, and integrity. We will experience joy and heartbreak. In those moments, the white coat becomes more than fabric. It becomes a promise to serve, to care, and to never stop learning. We would not be here today without those who stood beside us. To our professors and mentors, thank you for your patience, wisdom, and belief. To our family and friends, your love carried us through late nights and moments of doubt. Today belongs to you as well. From students to healers, from dreamers to doers, congratulations. The future of veterinary medicine is in our hands. Thank you.
That was beautiful.
Thank you.
Hello and welcome. For those who do not know me, my name is Megan White, and I have had the honor of serving as class president for the class of 27 for the last 2.5 years. Today, when you look around this room, you'll see a class that represents 19 states, countries, and territories, speaks 15 languages, and brings together countless backgrounds, paths, and stories. And yet, we all share something extraordinary. Fewer than 0.1% of people will ever earn the title of veterinarian. And today, we take one step closer to joining that group. This ceremony is about more than receiving a coat. It is the recognition and rite of passage across many medical professions, symbolizing the transition from the classroom to the clinic. The white coat ceremony was created as a way to emphasize professionalism, compassion, and the responsibility that comes with a career in caring for others. Today, that tradition becomes ours. Over the past 2.5 years, we've sacrificed more than just sleep. We've watched nieces and nephews grow up through group chats and Zoom calls. We've said goodbye to loved ones we wish could be here with us today. We miss birthdays, holidays, weddings, and ordinary moments that suddenly felt extraordinary from far away. But none of us got here alone. To our families, friends, partners, and mentors, we would not be standing here without you. You believed in us when we struggled to believe in ourselves. Through every late night, every exam, and every hard moment, you stood beside us. Whether you are here in this room or celebrating with us online, we are incredibly grateful for each and every one of you. To my classmates, thank you. Thank you for the study sessions that turned into therapy. Thank you for the reassurance after tough exams. Thank you for the Quizlets, Kahoots, and study guides. You are truly the unsung heroes of veterinary education. We showed up for each other, we lifted each other up, and we are standing here today because we chose collaboration over competition. What's going on in the world right now doesn't take away the community we've built within our class and within the CVM. Continue to lean on our community as we transition to earlier mornings, longer hours, and new challenges. Today, we put on our white coats as a symbol of everything we've already overcome and everything we're about to become. We will be doctors. We will be veterinarians. Congratulations! I'll see you guys in clinics.
Well, I have goosebumps. Thank you guys for those wonderful, wonderful speeches. Next, I want to take a moment to celebrate the teachers and the faculty selected by our students. Great teachers do more than share knowledge. They inspire, challenge, and shape the future of the profession. Today, we have the opportunity to recognize 2 educators who have made lasting impacts on our students. Here to present the Teacher of the Year Awards are Michaela Martell from Skanavta and McKenna Adams, past president of SAVMA.
Ready? Hi, everyone. My name is Michaela Martel, and I'm the current vice president of SCNAFTA, and I'm up here today to talk about our Teacher of the Year for the veterinary nursing class, Maggie. Today, we're honoring someone who does so much more than just teach anesthesia. Maggie shapes confidence, professionalism, and passion in every student that she works with. She has the rare ability to see potential in people before they even see it in themselves. She doesn't just teach numbers, machines, and protocols. She teaches critical thinking, accountability, and how to stay calm and focus when it matters most. What truly sets Maggie apart is how deeply she cares about her students. She pushes us to do better and supports us when we struggle. She creates an environment where learning feels challenging but safe, and where mistakes are treated as opportunities to grow. Because of Maggie, students leave this program not only more knowledgeable, but more confident in their abilities as future veterinary nurses. Maggie, thank you for everything that you do. This Teacher of the Year award is incredibly well-deserved.
Good afternoon, everyone. Thank you, Michaela. I am incredibly honored to be chosen as a veterinary nursing, by the veterinary nursing class for this award. Teaching is something that I deeply love, so being respected and valued by the students I care so much about, that is something that I will carry with me forever. You are the reason I love coming to work. You are the reason I stay late, tweak lesson plans, and the reason I occasionally Google creative ways to explain blood gas solubility without putting everyone to sleep. As an anesthesia nurse, I love control. I like calculated doses, stable vitals, predictable responses, patients who do exactly what I expect them to do. But over the years, I have learned that when it comes to those anesthetic parameters, that perfection is not the goal. And let's be honest, the patient shows us who's in charge. Stability, presence, and thoughtful response, that's the goal. It's about keeping the patient safe while balancing all of their needs. This year taught me that lesson in a new way. I had my second child, and I learned what it means to pour yourself into two callings at once, motherhood and veterinary nursing. But I had to let go of perfection. There were moments this year when I quietly wondered if I was doing enough, if I was giving my students the energy they deserved, if being stretched in two directions meant I was somehow falling short in both. So receiving this award from you was deeply reassuring. It reminded me that showing up imperfectly, but wholeheartedly, is still enough, that consistency matters, that care and presence matter. I want you to remember this because it is exactly what you are stepping into as you move to the clinic floor. You will not have perfect cases. You will not have perfectly predictable patients. You will have moments when the blood pressure drops and everyone in the room suddenly looks at you. And you will take a breath, you will assess, and you will respond, because that is what veterinary nurses do. You show up prepared, attentive, adaptable, and compassionate. You will be exactly the veterinary nurse that your patients need. This white coat does not represent perfection. It represents preparation and resilience. It represents compassion in action. It represents the willingness to stand in moments that are uncertain and say, I am here, I am learning, and I am ready. You have chosen a profession that demands intelligence, technical skill, emotional strength, and heart. You will be the steady hands. You will be the calm voice. You will be the patient's advocate when they cannot speak for themselves. And I hope you give yourself the same grace I learned to give myself this year. I actually did. My baby's name is Grace. Trust your training, and remember that showing up consistently and with care matter more than perfection ever will. Thank you again for honoring me. Thank you for trusting me to be part of your journey. Thank you for laughing at my jokes, for your hard work, your never dumb questions, and your honesty. You make me a better teacher every single year, and I learn just as much from you as you do from me. It is a privilege to watch you grow. And mostly, Thank you for reminding me that even in seasons of growth and stretch, there is beauty in the chaos. Today you put on your white coat, but long before that you showed the character and dedication that makes you worthy of it. So go forth with confidence and with the knowledge that you are exactly where you're meant to be. And always make sure to open the pop-off valve. Congratulations and thank you.
Hello, my name is McKenna Adams, and I am the outgoing president of the Michigan State University Student American Veterinary Medical Association. Over the past 2.5 years, our class has been given the incredible opportunity to work with a vast group of amazing clinicians here at Michigan State. Each instructor has been a valuable and influential component of our veterinary education, and we would not have made it this far without each of them. Every year, the class going into clinics is given the difficult decision to vote on an instructor to be awarded the SAVMA Teacher of the Year Award, which I am honored to present today. For this year's recipient, we want to recognize their dedication to improving our education, strengthening our decision-making skills, and building our confidence for clinics. As a lecturer, he takes the time to teach in a way that sticks with students while emphasizing our individual success and knowledge. Many of the moments that define us in veterinary school aren't the easy ones, but the ones that challenge us. For many of us, we initially dreaded the daunting lectures where the microphone was passed around the room to answer questions in front of every member of the class. Over time, these lectures have become many of our favorites, the ones that pushed us out of our comfort zone and helped us to remain calm under pressure. As we enter clinics, these are the lessons that will help us navigate our most difficult cases. Please join me and my colleagues in congratulating this year's recipient of SAVMA Teacher of the Year, Dr. Matthew Beal.
All right. I will first say that my remarks are not nearly as polished as those of my colleagues. I was talking to my 86-year-old dad and mentioned that I got this teaching award, and he gave me a good reminder. He said that that should mean more to you than recognition from your bosses. And it was a good reminder because getting something recognition from those that are a little below you on the totem pole means a tremendous amount. We have 3 missions here at the college as faculty: teaching, research, and clinical service. And the reason I'm still here after 25 years in emergency medicine is the teaching. It's you. It's the students, both from the classroom to the clinic. You're really what, when I look back at the end of each day, that's the part that gives me the juice to keep going on. So, I was asked to give a couple of pearls of wisdom or things that will help you be successful in clinics, because you've really kind of made it through the hard part. And the white coat is really nice. It's a little on the short side for me, but that's what happens to my people, tall people. I haven't worn a white coat in 30 years. Pretty uncomfortable in it, but it's mainly because my job is all emergency and critical care medicine, and within 24 hours on the emergency room floor, your white coat would be the color of all the various substances that come out of our sick and injured patients each day. So this is nice. I'll encourage you to wear a white coat, wear it with pride, but maybe wear it on the more civilized services. All right, so as I said, clinics is really, I hate to say it's easy, but you've gone through the harder part, so it's easier. But what I want to challenge you to do is in order to take more or the most from the experience, it's to try and make it a little bit harder. And there's a few ways I think you can do that. And by making it harder, obviously, I think you're going to take more from the clinical experience. First off, when you're on services other than emergency medicine, get the schedule for the day. If you know that you'll be seeing a PDA case on cardiology tomorrow, that night you go in and you review the anatomy and the physiology and the pathophysiology of the disease and the physical exam findings, physical exam, and the different diagnostic tests and treatment options for them. That way, you get there the next day, you had it preclinical, you've brushed up on it now, you're going to take more from interacting with the different cardiologists and their house officers that are on, and you're just going to have a much better experience. So I'll say do the prep work. I know it's like a dirty word, but there was a method to the madness. This is one of them. Next thing, get there early in the morning. We've made student work hours much more humane than they used to be, but still, the amount of time you're there interacting with your patients and with the people around you, the more you're going to take from that clinical experience. So when you get there in the morning, read your charts, examine your patients, do that full physical exam, even a rectal exam. Follow them throughout the day, but don't forget that the cases that you're working with aren't just your cases. Read your classmates' cases. Interact with those cases as well. Feel that dog's abdominal mass. Listen to its heart murmur. Listen to its abnormal lung sound. So you get more from just the case that you're working on. You're learning from all the cases on the service. Next thing, insert yourself. Ask permission to be involved, especially in technical procedures. I think the ER, we're pretty good. We are a service of lots of procedures, and we love getting students involved in that. But sometimes, and especially with some of the house officers, interns, and residents, they haven't done things that much themselves, but insert yourselves. Ask permission to aspirate that joint or that mass. Ask permission to unblock that cat with a urethral obstruction, or to close that skin when you're on a surgical rotation, or to bandage that limb. The worst thing that can happen is they say no. The best thing that can happen is you get a lot more good experiences from it. Keep a list of learning issues. You will see this on your feedback that you get every week on the emergency and critical care service. That list of learning issues you take home in the evening. I almost said at the end of the night, in the evening, and you do a little bit of reading on those. Search some of those things up. Take it all the way back to the anatomy and the physiology. And it's those extra actions. Like, it's pretty easy to just go home and flop down on the couch, walk your dog, eat some food, scroll, those kinds of things. But take that extra little bit of time to dig into some of those learning issues. I did the math on it. You've got 8 months approximately until the NAVLE. That's the board exam for those that aren't in it right now. 30 minutes a day, 6 days a week, adds up to about 100 hours. Those 100 hours aren't just helping you with the clinical management of your cases, they are preparing you for the NAVLE as well. So it just takes a little bit of extra time. Last two things I think are really important. Take a little extra time with your patients each day. It's still, next to teaching, it's the thing that I love the most. I love just sitting with a dog for a few minutes in the cage in ICU and petting them and listening to you guys present your round session or whatever it is. But take a little time with your patients. You'll interact with your patients way more than we will, and you'll detect abnormalities, whether it's negative changes or positive ones. You'll detect that better than us. You'll know them better than us. So take time to be with your patients. And then, even though we all love animals, most of the work we do, or a lot of the work we do, is working with humans as well, the humans that come in and attach to those patients. And some services are pretty warm and fuzzy. The dogs are healthy, they come to rehab, they're in the underwater treadmill, everybody's happy, they're getting better, they're getting stronger. And those client interactions are pretty easy. On other services, clients, they didn't plan to be there that day. They're worried about the health of their pet. They're worried about the finances because specialty medicine is expensive. And pretty much you're set up for failure from the beginning. And so just remember that those people have a lot of stressors in their lives, and try to give them a little bit of grace, no matter how challenging they may be. So that's it. Clinics, just like pre-clinics, it's what you make of it. You know, if you optimize your time when you're in it, you won't look back and, you know, maybe 5 years down the road, look back and feel like you missed it a little bit. So take advantage of every moment and enjoy it. And I really look forward to working with all of you. Thanks.
Thank you very much. And that's yours. Yeah. All right. Thank you, Dr. Beal. Thank you, Maggie, for your words of inspiration. I think it was McKenna who indicated how difficult it is to choose a single faculty member of the year. And so I hope you all join me in just one more round of applause for all of our amazing faculty who support our students' learning. All right, now with that, the moment we've been waiting for. It is time to mark the official transition of our students from preclinical to clinical studies. And so I'd like to invite Taylor Epp, Associate Dean of Veterinary Nursing, to lead us through this important next step for the veterinary nursing program.
Thank you, Dean Dodd. Today marks a pivotal moment in the academic journey of our students, and we are proud to officially welcome them into the clinical phase of their education. Now, the moment you've all been waiting for, it's time to present the white coats. Bobby Thielen. Brooke Akram. Mason Atkinson. Kelly Breeden. Lily Covert. Morgan Dietz. Haley Friedline. Joe Gallagher. Amanda Griffin. Gabrielle Henderson. Annalise Hendricks. Lauren Huttinga. Jillian Jansen. Natalie Johnson. Janina Kavetsky. Alex Mead. Courtney Mazeski. Ava Nevitt. Avery Ray. Grace Rutz. Delaney Sanchez. Valerie Seville. Rebecca Sapanik. Joshua Shimmons. Naya Smith. Rose Spiro. Stephanie Spinella. Gina Ward. Mallory West. Abigail Yeomans. Elizabeth Durkatch. And Michaela Martell. Let's give one more round of applause to our veterinary nursing students. Now I'd like to invite Dr. Rob Fowkes, Interim Associate Dean of Professional Education, and Dr. Stephen Carey, Associate Dean of Student Engagement and Success, to the podium to present the DVM students with their white coats.
It is our pleasure to introduce to you the Doctor of Veterinary Medicine candidates from the class of 2027. McKenna Adams.
Madison Rose Aarons.
Amanda Amador Roller.
Yahawa Ashakwa.
Stephanie Bernal.
Christine Bowen.
Jessica Bradford.
Carly Brisendine.
Daniela Cabrera.
Cora Campbell.
Miranda Carasosa Gibbs.
Lillian Casania.
Melanie Cavieres.
Julian Cienega.
Ashley Clark.
Lindsay Coleman.
Lizette Cotto.
Kenan Geraldine Dawson.
Anthony Diaz.
Thank you. Stephanie Dominguez.
Rachel Arlowen Downing.
Brittany Eddington.
Mary Enfield.
Timber Phelan.
Katie Floor.
Rihanna Foster.
Kristen Foudy.
Shelby Friend.
Claudia Marie Gable.
Paige Garland.
Annika Germain.
Shailene Gedtil.
Lindsay Granco.
Amelia Herridon.
Autumn Lauren Harris.
Kamari Harris.
Haley Hartman.
Alexandra Hodges.
Lily Hollingsworth.
Caitlin Hong.
Hope Harker.
Kaylee Hudson.
Jordan Hughes.
Haley Jennings.
Mihal Gerasi Apolker.
Hannah Cadets.
Anna Kerr.
Marie Komorowski.
Gina Kuhlberg.
Kaylee Laidlaw.
Taylor Mayfield.
Luke Middlebrook.
John Morrison.
Cara Mosier.
Madison Myers.
Linda Duimana.
Aaron O.
Paola Pardo.
Brittany Passo.
Rachel Phillips.
Evanis Ralat Vargas.
Eva Rand.
Sumeda Reddy.
Riley Richardson.
Aaron Reidenauer.
Alba Rodriguez Acosta.
Margaret Russell.
Wayana Schalk.
James Senholzi.
Toyin Shoe Mimo.
Riley Corty Simmons.
Erin Sneed.
Sydney St. Clair.
Kelsey Sukert.
Elaine Tennyson.
How you doing? Savannah Thompson Tuchek.
Congratulations. Gabriela N. Toledo Seda.
Emily Tatora.
Congratulations. Madeline M. Van Winkle.
Sarah Akuma.
Congratulations. Daniela Stephanie Vibriesca.
Lindsay Vieira.
Dr. White. Congratulations. Nice speech, too. Megan White.
Kelsey Wickham.
Congratulations. Rachel Wilkening.
Ann Taylor Williamson.
Congratulations. Julia Windsor.
Angela Wolf.
Congratulations. Jessica Wood.
Lauren Yen.
Congratulations. Lindsay Zombeck.
And Emma Zupan. With your coats proudly on, it's time to take the next step in this journey. So I'd like to invite Taylor Epp back to the podium to lead our veterinary nursing students in reciting their oath.
Thank you. As you prepare to enter the clinical setting, the veterinary nursing student oath serves as a reminder of the responsibilities and commitment you have chosen to uphold. Will the veterinary nursing students please stand and join me in reciting the oath? The oath can be found at the back of your program. All together. On this day, as I continue pursuit of the veterinary nursing education at Michigan State University College of Veterinary Medicine, I earnestly commit myself to professional development. This includes not only the acquisition of scientific knowledge, but also personal development. I recognize the veterinary nurse's role as an integral member of the animal health care team. I will continue to learn my chosen profession from this day forward with integrity and keeping with the standards of the college and the ethics of veterinary medicine. As a student, I pledge to respect and show compassion for my fellow students, college faculty and staff, the animals under my care, and animal owners. Finally, I accept as a lifelong obligation the continual improvement of my professional knowledge and competence. Good job. I'm pleased to introduce Dr. Julie Strakota, Director of Clinical Education, who will lead our Doctor of Veterinary Medicine students in their oath.
Thank you, Taylor. The Veterinary Medicine Student Oath is a tradition that signifies our students' dedication to ethical and professional responsibilities as they step into clinical practice. Will the DVM students please stand and join me in reciting the oath? The oath can be found at the end of your programs. Okay, ready? On this day, as I continue my pursuit of the Doctor of Veterinary Medicine degree at Michigan State University College of Veterinary Medicine, I earnestly commit myself to professional development. This includes not only acquisition of scientific knowledge, but also personal development. I recognize the veterinarian's oath as a leader in society and will continue to learn my chosen profession from this day forward with integrity and in keeping with the standards of the college and the principles of veterinary medical ethics. As a professional student, I pledge to respect and show compassion for my fellow students, college faculty and staff, the animals under my care, and animal owners. I accept as a lifelong obligation the continual improvement of my professional knowledge and competence. Very good. To officially welcome you to the clinical phase, I am now like to introduce Dr. Kelly Myers, Executive Director of the Veterinary Medical Center.
Thank you, Dr. Strakota, and good afternoon, everyone. Today is a milestone worth celebrating. After this long stretch of winter, and as I was thinking about what I should share today, I was thinking about renewal that happens when the snow finally melts and it's time to garden. We're now in second winter, right? Third spring will be here soon, don't worry. But I love gardening, and my favorite flower is the peony. And I'm always so surprised when spring hits, and just out of nothing, there's nothing on the ground, and this big bush comes out of nowhere, and these big, beautiful flowers very quickly come into fruition. And I was comparing that really to you and your growth as a student. In the last 3 years, 2.5, your learning has happened in carefully prepared conditions. The classroom gave you structure. The curriculum gave you your essential nutrients. Your exams, well, those were a little like weather events, kind of like today. Sometimes sunny, sometimes not. But through it all, you're taking root and you're growing. The clinic floor is where growth really becomes visible when that peony bush starts to put up those shoots. This is the time that you're going to really start to see that growth and all of that work that you put in pay off. It's where decisions really matter in real time, where teamwork is essential, and where patients, and along with the people who love them, remind us of why this work matters. Some days, everything will feel like it's coming together, and then on other days, it might feel like you're stretched too thin or you're uncertain. But know that both of those is part of becoming a capable, well-grounded veterinary professional. The hospital is ready for you. Our faculty and staff always look forward to this moment every year. There's energy that comes with new students, new questions, fresh perspectives, and the mix of excitement and nerves, some of which you might be feeling right now. You remind us of why we do this work, and we're excited to grow right alongside you. We learn things too. As you step onto the clinic floor, stay curious. Ask questions early and often. Lean on the teams around you. Competence grows through experience, reflection, and support, not perfection. Today's coding isn't about being ready. It's about being prepared to learn in a new way, in a place where the work is real and the responsibility is shared. So wear your coat with pride. Step forward with confidence and humility, and know that the hospital doors are open for you, not just as students, but as valued members of our hospital team. Welcome to Clinics. We're excited to work with you.
Thank you, Dr. Myers, and thank you to all of our speakers and presenters today. Also, thank you to all of the coders. There's few things more nerve-wracking than putting on a white coat on a stage in front of hundreds of supporters than being the person helping the person put on the white coat in front of hundreds of supporters. So thank you all for being here. Thank you to everyone who's joining us remotely online for this amazing milestone. To our students, this is just the beginning of an exciting new chapter in your veterinary careers. Embrace every opportunity, stay curious, and have fun. Congratulations once again, and best of luck in your clinical experiences. As we prepare to conclude the ceremony, I want to take a moment to thank our interpreters, Lyra and Stacy, for their support throughout the ceremony. We'll hope you'll join us now upstairs for a celebratory reception right outside of the auditorium. Thank you all for joining us today, and I hope you'll all join me, including the folks on stage, in one last huge ovation for our students, their families, their friends, their supporters, and for the future of veterinary medicine. All right, let's start the party. Upstairs, we'll see you at the reception. Go White!
Let's all stand and sing the greatest college fight song in the land, the MSU Fight Song.